Let's begin with section 1 of our lecture, sinusitis. In this section, we will talk about the etiology and pathology of sinusitis. Etiology is the causes of sinusitis, and pathology is the study of the disease process that ultimately leads to sinusitis. And besides this etiology and pathology, in this section we will also talk about the bacteriology or different bacteria that cause sinusitis or cause infection of the sinuses. Sinuses are the four empty spaces around the nasal cavity. That's why they are known as paranasal sinuses. So we have four sinuses. Frontal sinus, as the name shows, it's in the frontal lobe of the skull, and this is the frontal sinus. So any pressure on the forehead or increased headache or pressure in the forehead region is due to infection or inflammation of the frontal sinus. Then around the inner canthus of the eye, we have sphenoid sinus on the upper part, and then in the lower part, close to the nose and the eye, we have the ethmoid sinus. And then in the cheek, we have maxillary sinuses. So these are the normal sinuses present. This picture shows if there is inflammation of the sinuses leading to sinusitis, then how they appear. They have inflamed lining of the sinus. Inflamed lining of the sinuses leads to increased production of the mucus, and there is discharge and there is stuffiness of the sinus. So this is the picture with inflamed sinuses. You can see there is excess mucus production, and this is excess mucus present in the sinus, maxillary sinus. So that's the sinusitis. Inflammation of sinus mucosa is called sinusitis. Itis is for the inflammation. So inflammation of sinuses is sinusitis. Inflammation of the nose is rhinitis. Inflammation of the gums is gingivitis. So make sure whenever there is itis is inflammation of that particular area. So inflammation of the lining of the sinuses leads to sinusitis. It can be open or closed. The discharge can be flow into the nasal cavity and cause the discharge and secretions, but sometimes it is closed, and this can be more serious because there is no discharge and the fluid keeps on accumulating in the sinus and it causes more congestion and stuffiness. So can be open or closed. Types of sinusitis, we have acute sinusitis, which is of short duration, acute onset, and then the other type is chronic sinusitis, which stays for the longer duration of the time or for longer period. So sinusitis can be acute or chronic. Depending on the length of the time the sinuses are affected or inflamed, it is divided into acute and chronic type. Acute sinusitis is this is again the normal size. We have frontal sinus, then we have the sphenoid, ethmoid, and this is the maxillary sinus, and this is the ostium of the maxillary sinus or the opening of the maxillary sinus. So acute sinusitis is most commonly involved sinus is the maxillary sinus here. This is the most commonly affected sinus in the acute sinusitis. It proceeds to ethmoid, frontal, and sphenoid sinus. So first sinus that is mostly involved in acute sinusitis is maxillary sinus. From the maxillary sinus, it can spread to ethmoid, frontal, and sphenoid sinus. So first most commonly affected is the maxillary sinus here. Can be multi-sinusitis. All the sinuses are involved from the maxillary sinus and affects all the sinuses. Or can be pansinusitis, more than one affected, maybe unilateral. Only one side is affected, or maybe bilateral when both sides of the sides are affected, both frontal sinuses, both ethmoid, sphenoid, and maxillary sinuses are affected. So that's pansinusitis. Closed, as the name shows, when it's closed, there is no passage of the excess secretion to drain that excess secretions. Then it is more severe. Symptoms are more severe because then the patient will have more pressure and stuffiness and congestion, because the secretions that are produced, they stay inside the sinuses and they are not being drained. So that's acute sinusitis. Affect the all the sinuses, and it can be open or closed. Maxillary sinus is the sinus most commonly affected. Then etiology of sinusitis. What's the causes of sinusitis? We have exciting causes that can cause the sinusitis, like nasal infections. Any nasal infections, they can spread to sinuses and cause sinusitis. Then trauma. Any trauma can cause sinusitis. Dental infections, upper dental infections, very common cause of maxillary sinusitis, because they are very closely associated with maxillary sinus, and from the maxillary sinus then infections can spread to other sinuses. Then also swimming and diving can cause sinusitis. Then we have predisposing causes. Some predisposing factors, if they are present, can cause sinusitis. Can be local causes, which include obstruction to sinus ventilation and drainage. So if there is obstruction, it can cause sinusitis. Then stasis of secretions in nasal cavity. If the secretions in the nasal cavity, they are not flowing and they are not excreted properly, this can cause stasis of the secretion. And the stasis have more chances that they can get infected and can lead to infection. And then this nasal infection can spread to sinuses. So it's a very, very important local predisposing factor. Previous attacks of sinusitis, if there is a history of sinusitis, it can cause sinusitis again. Then we have general causes also that can cause sinusitis, like different environment. If people are allergic to some things and they are present in the environment, they have rhinitis, and that allergic type of rhinitis cause sinusitis also. So environment is an important factor. Then poor general hygiene, that's also important, or poor general health. If there is diabetes, fever, that can cause sinusitis. So all these are different causes that can cause sinusitis. We have some causes that directly lead to sinusitis, and some are predisposing factors. if they are present, the people have or patient have increased chances of developing sinusitis, which may be local or which may be general. Next, the bacteriology. What's different bacteria that can cause sinusitis? Usually, it starts as viral infection. Viral allergies, viral infections are common that can cause rhinitis, and usually common cold is due to viruses, so that's the most common cause that can cause sinusitis also. So the virus usually the infection begins as the viral infection. Then there are also some anaerobic organisms. Anaerobic are the organisms which do not require oxygen for their growth and multiplication. Aerobics are the microorganisms or bacteria that require oxygen. Anaerobic do not require oxygen. Then sometimes we have mixed flora, mixed infections, viral infections superimposed by bacterial infection, different bacterial infections, different microorganisms present that can cause sinusitis. So mixed organisms or mixed infections are also present. Then we have followed by bacterial invasion. So sinusitis first begin as viral infection. Then there is superimposed infections and superimposed bacterial infections, which are also anaerobic organisms which can grow without the oxygen. They can cause infections. So the most common bacteria that can cause sinusitis is the Streptococcus pneumoniae, that's the common microorganism. Then Haemophilus influenzae, then Moraxella catarrhalis also cause infection. Streptococcus pyogenes and Streptococcus aureus, and also Klebsiella pneumoniae. So all these are different bacteria that can cause sinusitis. But remember that the viruses are most commonly involved, initial causative agent for sinusitis, and then there is superimposed infections in which bacteria are involved, and the common bacteria are Streptococcus, Haemophilus, and Moraxella. So these are some common microorganisms, Klebsiella also, that can cause infection. In this diagram, you can see different microorganisms. These are the round shape cocci. Cocci are round shape, and these are the rod shape, which are the bacilli. So different microorganisms can cause infection. Next, pathology of sinusitis. Pathology, or how the sinus develop, what's the abnormality, what's the disease, how process that can lead to sinusitis, mostly depends on how virulent is the causative organism and what's the defense mechanism of the host defenses. If the organism is more virulent and the person's immune system is weak, usually the infection is more severe as compared to if the organism is not as virulent and immune system is strong, then the infection is less severe. Mild is usually non-suppurative, no pus present. Severe type of infections is usually suppurative with the formation of pus. Serous exudate is present, which might be mucopurulent or purulent. This leads to, we have, after the involvement of the mucosal lining of the sinuses with different microorganisms, depending on the virulence of the organism, this can lead to hyperemia and fluid exudation. There is increased fluid present. Here you can see the picture with the swelling and redness. This is hyperemia and fluid exudation. The fluid comes out. Then there is outpouring of polymorphonuclear cells. Whenever there is infection, there is increase in the white blood cell level to fight that infection. So in the area, the neutrophils or polymorphonuclear cells, they increase in number. There is increased activity of serous and mucous glands. As a result of inflammation, there is inflammation of mucus and serous gland, and this causes increased production of mucus and serous fluid. Dental infections also can occur as a result. Dental infection can lead to sinusitis in the maxillary sinus. Then we have empyema of sinus and destruction of the sinus wall. So all this is the pathology, how this develops. There is increased fluid exudation, increased polymorphonuclear cells causes hyperactivity of the glands, increased production of the serous fluid and mucus, and then this can cause dental infection and empyema of the sinus and destruction of the sinus wall in the ultimate final step of the pathology of sinusitis. So this was all about section 1. Thank you for watching sqadia.com.